Forward on a subject that affects all of us, health insurance. The Affordable Care Act subsidies will expire at midnight Wednesday, the same time we're ringing in the new year, which means the cost of health insurance for 1 million people in North Carolina and more than 600,000 in South Carolina will increase dramatically. The average increase is a staggering 114% per person. Some fear they won't have affordable coverage and potentially face detrimental medical bills if an emergency strikes.
I just think that everyone should be able to go to the doctor without even worrying about what is this going to cost, because it is the way we maintain our body, the way we are able to engage in our communities, work, go to school, and all of that, and take care of ourselves and our families.
Well, that is Nicole Dozier, interim director with the North Carolina Justice Center. They advocate for folks in the state for affordable health coverage and medical bills. North Carolina has the fourth highest percentage of people with medical debt in collections nationwide. In some counties, more than 40% of the population is drowning in medical debt. Medical expenses are the #1 reason people file for bankruptcy. Dozier says help is available, especially for hospital debt.
Related to hospital coverage and hospital care and medical debt, North Carolina has something that no other state has, which is through HHS. It's a medical debt relief and forgiveness program. Definitely ask people to go there if it is related to the hospital debt. And what that, so far since July, over $6.5 billion with the B dollars have been forgiven for 2 million people. So the first thing people want to do if it's hospital debt is first go and see the people who are before you're registering, while you're registering, and make sure that you're not eligible for a discount, and then see if you're able to have any forgiveness. And then also there's an organization called $4. That organization goes through with you, can pull up the different plans and walk through that with you and ensure that you're not paying for something or go into financial ruin because you dared to get sick or have a health condition or a complicated pregnancy.
Well, the most important thing to remember here is you have to be your own advocate. When making a healthcare appointment, ask questions. How much is the treatment? Can this price be negotiated if I'm not insured? Can I put up a payment plan I can afford? And when you get a bill, request it to be itemized. Check the charges to make sure they're correct and nothing extra has been added to that bill. Now, be wary of signing up for a medical credit card. They generally have high interest rates, and some providers will charge more for treatment when you're paying that way. And if you have a promotional card, if the bill is not paid in full by the time the promotion expires, rates can jump up as high as 25%. Most importantly, read over financial documents thoroughly before signing anything. If you can no longer afford ACA coverage, it's not too late to find new insurance. There are organizations that can help you find what you need and what will fit your budget.
Our friends over at the NC Navigators Consortium, if I need to go in the marketplace, I would not do it myself. I would go and connect with those wonderful advocates there and have people walk them through. Because if it comes up that you are eligible for something, they may find it and you just may not. With all the things that people are going through, this is the last thing people need to be concerned about is now how I'm going to pay for the fact that I need to deal with this condition or manage it or just have preventive care. So those are just a couple of things I want to say right off the bat. Related to other financial assistance or other help, people need to remember about going to the Department of Health, the Department of Insurance. People might remember the SHIP program, Seniors Health Insurance Information Program for older adults. There are folks who are in senior centers, including the one here in Apex and all over the state, where we'll sit down and talk and walk people through what they're eligible for. Don't get things that you don't really need.
The North Carolina Justice Center says they will continue to fight for fair medical coverage for everyone here in the state. Now, even though there are resources out there, they say it's just not enough. You're taking a live look at Capitol Hill right now in Washington, D.C., where people are hoping Congress will pass some type of extension on the subsidies before January 15th, so an additional 24 million Americans won't have to decide between medical treatment and housing or food come February 1.